Let's look at some of the most common patient presentations of plantar heel pain that you're going to see in your clinic and how the 4-step DOLA process can help you prescribe and manufacture a cost-effective prescription orthotic. We'll explore the concepts of orthotic dose and how to replicate your successful treatment-directed testing with common in-clinic orthotic modifications for patients presenting with a range of foot types.
Case 1 is a common plantar heel pain presentation, with risk factors including occupational demands, foot type, and work-specific footwear.
Patient 1 is a male builder with pronated feet and plantar heel pain. This is a typical male presentation, 40 years old and around 85 kilos. He's got an active lifestyle and works long hours on his feet wearing safety boots. He's got a flexible pronated foot and passes the lunge and jacks test for sagittal plane function. He's had a painful heel for 3 months, which presents with pain at the fascial origin at the calcaneus and also spreads into the proximal plantar fascia. It's worse first thing in the morning and when he gets out of his car at the end of the day after work. This patient responded positively with fascial support and antipronatory strapping. Let's go through the pathway for a orthotic prescription.
Step 1. Let's pick the DOLA Pro style for this patient. His work boots have a removable insole, so a full-length device is ideal and there is plenty of space, so we'll go with the full-featured DOLA Pro full length. And then based on his body weight and control required, we'll use the medium density Pro 80. Step 2. Let's look at his foot type to see what prescription we need to add to the DOLA Pro shell. The fully reinforced medial arch support of the DOLA Pro will reduce the load and strain on the fascia during load, stance and propulsion, especially in the pronated foot. And with a moderately pronated foot, we're looking to increase the dose to a more moderate dose of medial orthotic reaction force. To do this, we'll add more rear foot control with an extrinsic EVA rear foot varus wedge. The wedge is thicker on the medial side to tilt the foot outwards and support the pronated foot. The flat plantar surface of the DOLA Pro allows fast and easy application of these self-adhesive wedges. Step 3. Now we need to look at the pathology or tissue stress and see if there's any further prescription required there. With plantar fasciitis, most of these include adding extra cushioning to reduce the load. So we've gone for a full-length pour-on cushioning layer. We could have gone for just a pour-on heel pad. However, with the full-length pour-on layer, we're able to provide increased cushioning to the entire fascia and foot. And there is plenty of space in his work boot, so the overall device thickness and fit won't be an issue. Step 4. Due to his work, we need a really strong, durable top cover with a high quality look and feel, with added moisture wicking properties. So we've chosen the DuraFit top cover. The aim of this orthotic is to provide a moderate dose of medial orthotic reaction force with cushioning and a hard-wearing top cover. All of the items that you'll need are laid out here on the desk. So let's have a look at how we're going to make this in clinic. So we just take all of our components here. We're starting with the rear foot varus wedge. Just make sure that with the rear foot wedge that we're placing the thicker portion on the medial side to give you that varus or medial control. If you want to make it a lateral or a valgus wedge, then just make sure that that's thicker on the lateral side. That's just going to help with the direction that we're trying to give that rear foot control. What we're going to do here is we've got the mid-layer pour-on. We're just going to glue this with our contact adhesive. So remembering to glue both surfaces, so the top surface of the orthotic and the top layer of the pour-on. You can use a heat gun here just to try and help the drying a little bit quicker. And then what we're going to do is apply that pour-on onto the DOLA Pro shell. So start distally and then just press backwards towards the heel cup. Get a nice firm contact, make sure that there's no air bubbles, and press down nicely around the edges of the shell. What we'll do then is we'll just trim it down. So just before grinding, if we trim down around the edges, it's going to make it a little bit easier to grind. And then what we're going to do is take it straight off to the grinder. Depending on what sort of setup you've got here, obviously you can grind it a few different ways, whatever's easiest for you. Given that it's a mid-layer, the nicer the surface and the more we can trim inside, as you can see in here with the Dremel, the easier it is to finish, the nicer the top cover is going to look and the more professional it's going to look as well. So once we've finished that mid-layer application, we're just going to glue on the DuraFit top cover here. So DuraFit's a really, really nice professional durable material. It's got really, really good wear properties and has got a lot of moisture absorbency and wicking as well, which is perfect for a work boot. Once again, we're just going to hit it with a heat gun here just to dry things a little bit quicker. And we're applying from distal back to proximal as well to get a really nice finish. So pulling down on the edges really nicely. And this is something where if you've taken that little bit of extra time to make sure that you've got those edges ground down nicely on that mid layer, then it's going to make a big difference in terms of the overall finish that you've got. We trim that back down again with the scissors, so this is just going to save a little bit of grinding time if you get this trimmed down nicely. And then we're just going to do the final trim to make this look perfect to go into the boot for the patient. So fairly, the DOLA Pro is designed obviously for a lot of these customizations and optimizations to be made really, really quick and really, really professional in clinic. So it's something that's been designed over a lot of time just to help you out, and you're going to get a really nice result. Once this is all done and we're finished with the grinding and you're happy with the look and the feel of the orthotic, then we are just going to do a fit into the boot, and then you're just going to give it to your patient and he can start wearing it.